because it's not broadcast yet. All right. Welcome, everybody. We will get started in just a couple minutes. I know people are still logging on, so we will get started with the webinar in just a few minutes. Thank you so much for joining us. Great, we're really excited to see so many people joining us. I think we have a lot of people on. So Mark, if you want to go ahead and get us started.
All right, terrific, everyone, and welcome, everyone. It's a pleasure to be participating, all of us, in this in the City Health Dashboard's one-year anniversary webinar, Empowering Cities to Create Thriving Communities. I'll be joined by three colleagues today. George Hobor from the Robert Wood Johnson Foundation, Shoshana Levine from NYU School of Medicine's Department of Population Health, and Becky Jo Glover from the City of Grand Rapids. And we have a great webinar ahead and are looking forward to everyone's participation. So the next. Let me just get started by mentioning a couple of housekeeping details. The webinar is being recorded and will be shared. Please use the webinar's raise your hand feature, which you can find in the participant view of your screen if you cannot hear us. To contact us, use the webinar's chat feature. If you have technical difficulties or would like to submit questions for the Q&A, which we encourage. And all phone lines, except for ours as presenters, are muted. So those are the housekeeping details. Onwards. How to ask a question. So we are counting on, there's a large number of you participants, which is really fantastic. And so we're looking forward to leaving time for Q&A and or including questions along the way. So, and it's quite easy to ask a question. You really just click the speech bubble you see there on the lower left, right above the chat. The word chat is a bubble. That's the speech bubble that opens the chat box. You can raise your hand, use the raise hand feature to notify us if you have an issue like not being able to hear us or see the screen, and we'll send you a message. You can also type your text into the chat box and press enter to send it. You can select to talk to just the panelists from the dropdown or change it to all panelists and attendees, in which case everybody sees your question. And finally, make sure please to tell us your affiliation before asking your question. Very helpful. And just to see how on the ball we are, next slide. We're going to ask you to share your thoughts by way of a poll, which we're going to put up right now, which asks the question, what sector do you work in? Do you work in local government, not in a health department, or in a health department, or in a nonprofit, or in academia, or in other? In which case you can let us know in the chat. So please answer. You should have seen that pop-up screen and let us know. We'll leave it up for a moment so people can write in.
Thanks, Mark. We'll give everyone a few more seconds to respond. We've seen some really great responses. I'm going to go ahead and close the poll and share the results.
Okay, terrific. Wow, what a diverse group of sectors and really settings we're drawing from. Local government, health departments, nonprofit, academia, and others. So, and it's great to see you writing in about the others. Very illuminating. So thanks very much. we will try to reach, and I think actually it's going to have rich value to everyone. Next slide, please. Objectives for today. All right, so we have really just 4 objectives. First is really to provide an overview of the City Health Dashboard and its new interactive features that enable communities to better pinpoint their greatest health challenges and to take action to improve health. In addition, we are going to discuss some trends in city-level life expectancy gaps and their association with racial and ethnic residential segregation. We're going to hear from Grand Rapids, Michigan, really showcase it in terms of how it uses the dashboard's data to drive change in its community. And finally, really to share our sense of urgency around the fact that people living just a few miles apart can have vastly different opportunities for health and well-being. So share your thoughts via chat at any point. While you're listening, maybe you can write in and just let us know what city you're joining us from. And we will let that happen.
Well, we are seeing some really diverse cities here from all over the country. Thank you everyone for sharing. Got Providence, Greenville, Boston, Atlanta. Keep them coming.
Yeah, very fantastic to see these flashing across the screen. We'll make them, the whole ensemble of them accessible to everyone shortly. And then finally, I think we're going to turn on, keep typing in your cities, but to keep us moving forward, we'll go to the next slide. It's my pleasure now to turn the roster over to George Hobor, Program Officer at the Robert Wood Johnson Foundation. George.
Thanks, Mark. I'm so pleased to be here with you today. For those of you who don't know us, the Robert Wood Johnson Foundation is the largest philanthropy in the US focused on health and healthcare. We've been working in partnership to build a culture of health across the United States. For us, that means removing barriers so that everyone, no matter who they are, where they live, or how much money they make, has a fair and just opportunity for health and well-being. In particular, we focus on low-income communities and communities of color because they often experience the greatest disinvestment and face deepest challenges associated with poverty and other conditions that lead to poor health. Next slide, please. We've learned that data are a powerful tool to help both leaders and residents of a community drill down to see where health challenges exist, how things like education, housing, and other factors are shaping health, and where people need the most help being healthy. Next slide. The Robert Wood Johnson Foundation supports multiple efforts to provide community leaders and residents with local health data, as well as data about the drivers of health at the state, county, city, and census tract levels. These data resources allow communities to uncover health challenges, better target resources, and measure progress toward ensuring a fair and just opportunity for health. Check out our Better Data for Better Health page to quickly see the many data projects that we support. Next slide, please. We know that data at every level, national, state, county, city, and neighborhood, are critical, which is why we support multiple efforts to put this information at the fingertips of local leaders and residents. For example, earlier this spring, we recently released our annual county health rankings. And in the fall, just last year, we supported the launch of the United States Small Area Life Expectancy Estimates Project, known as USA LEAP. That introduced the first public health outcome measure available nationwide at the census tract level, measuring life expectancy at birth for nearly every census tract in the country. Next slide, please. We're excited to hear how the dashboard has been helping communities across the country over the past year to better understand the connection between where you live and how healthy you are. I love hearing how the dashboard has given city leaders, advocates, and researchers a common language to better collaborate with others in your own community or outside of it. Our hope is that the new features will provide more tools to better pinpoint greatest challenges and opportunities, as well as target resources to create more thriving communities where everyone has the opportunity to live a long and healthy life. With that, I hand it back to you, Mark.
Fantastic. Thanks so much, George, and for the Foundation's support in this work. So I'm going to give you a brief overview now of the dashboard, sort of big picture. If I could have the next slide. We're going to ask you first, though, just to get a sense for people's familiarity with this resource. Have you used the dashboard, the City Health Dashboard, before today? Just yes or no. And we'll let that run for a moment.
Great, we'll let that run just for a couple more seconds as you all finish up answering.
All right. We have a 1/3, 2/3 breakdown of previous users to new users. I think you can all almost count yourselves the no's as new users, but once by the end of the day, I'm sure you will have all become new users. It's that easy. So next slide. So essentially, the City Health Dashboard is a web-based resource that we created because most data on health and drivers of health are not actually organized at the city level or the neighborhood level, but rather at the county and state or national level. So last year, the City Health Dashboard essentially changed that for the largest 500 cities in the country. It's an online resource that provides city and neighborhood level measures of health, like life expectancy and smoking rates, and factors that shape health, like housing affordability and access to nutritious foods, so that cities can get a more detailed picture of health at the very local level. The dashboard helps cities with populations of about 66,000 or above to target their efforts to improve the well-being of residents neighborhood by neighborhood. The dashboard launched last May 2018. It was developed by our team here in the Department of Population Health at NYU School of Medicine in close collaboration with NYU Wagner, the National Resource Network, the National League of Cities, and the International City and County Managers Association. We also work closely with our city partners, many on the phone today actually, to create an easy-to-use one-stop resource to help create healthier and more equitable communities. Next. So what are the measures that the dashboard includes? They are these. They're in 5 categories. There are 37 measures altogether. And as you see, the categories are clinical care, essentially health care, right? So prenatal care, preventive services, dental, insurance coverage, health behaviors, some very important health behaviors there. The physical environment, air pollution, park access and walkability, healthy foods, lead. Fourth category are really on a series of health outcomes, like from specific health conditions, cancers, cardiovascular mortality, obesity, diabetes, and also frequent physical and mental distress and life expectancy. And finally, and importantly, the 5th category is social and economic factors, where we look at a number of measures of education, which of course profoundly affects health over the life course, educational attainment, poverty, income inequality, racial, ethnic segregation by neighborhood and diversity by city, and housing costs and unemployment and crime. So really trying to bring together health and its determinants into a single place. You're not looking at just one or just the other. You get the holistic picture of what really is going on and what might be driving it. Next. I should say if you go back one slide, that the way that we do this is we access the national data sets in as granular a level, sometimes restricted as possible, and calculate them down with our analytic team to the city and census tract boundaries. So these are all derived from national data sets for the most part. Next. So key features of the dashboard resource, and you're going to get a demonstration of it soon, are that you're able to compare across neighborhoods and across cities, compare your city to other cities in the region with similar populations, and really there's a whole section on priority setting and targeting resources. And this is one example that we're going to speak about in just a moment, some more that looks at life expectancy. And you could, for example, look at differences across neighborhoods in life expectancy. This is a map of Columbus, Ohio, and we'll address that a little bit further on in the talk today. Next. So looking back at year one, it's been a rich year, and so sort of to celebrate our anniversary, we wanted to just describe a couple of successes and milestones. Next. We're excited, really, that the website has just seen a steady increase and heavy increase in traffic since we launched last spring. More than 55,000 visitors, more than 1,000 downloads of data, which is really terrific. And we're going to make that even easier going forward. We're also excited that the data is being used by people in every state and downloaded as well, including many countries, which is another interesting question, and we can talk about that another time. You can see that the top measures that are most clicked on and most searched are high school graduation, racial ethnic diversity, and children in poverty. Next. One of the important directions that we have begun to do work in, and we've begun to, and will be an increasing focus in the year ahead, is really on tailoring our support for cities and communities' specific goals or initiatives. So, for example, it may be that a specific city is doing a lot of work in housing and health, and would like to see elements of the dashboard be linked to local and administrative housing data or data on blight. So that's one way that we are looking to work with you to customize the data, the dashboard. There may be other kinds of analyses that people would like to see done. We're very keen to move below the cut point of 66, population cut point of 66,000, and be able to offer the dashboard to cities that are smaller in population. The tension there is that the smaller the size of the city, sometimes the thinner the data are, and so you get into issues of how reliable the estimates are for smaller cities. But we've thought very hard about that, and have some approaches that we're looking forward to rolling out ahead. We're also interested in providing additional geographic breakdowns. For example, you can look at your city by census tract now, but perhaps you'd really like to see it by congressional district, for example. Well, that could be doable, or in some other sense. And so we're looking for opportunities to partner with you on that. And then, of course, user-driven visualizations, charts, graphs, maps are all in our toolkit. So a lot of rich work, and we're really keen to be forming engagement-oriented, really kind of results-oriented partnerships with you on all of these. Next, please. So in preparation for our one-year mark, we wanted to look more closely at the data and share some national trends with you. These trends reinforce that really where you live can very much matter to how long and how well you live. A theme that isn't new to all of you, but is, I think, brought into pretty sharp view by on the next slide. So here, what we did is one of our measures, as I mentioned, is racial and ethnic segregation by neighborhood within a city. And if you, we looked at life expectancy in our cities, and looked at life expectancy in the census tracts of each of our cities, which is one of the measures that's on the dashboard, life expectancy, and it's calculated at the census tract level. So, but what is interesting, of course, is that in many cities, there is a gap, a range of life expectancies according to neighborhood. and just by census tract, such that if you are, for people who are born in a certain census tract, might be have a life expectancy that's quite different by 10, 20, even 30 years than people who are born in another part of the same city, often not more than a mile or two away. And so we looked at those data across the 500 cities in the dashboard and looked to see to what extent that the size of that gap in life expectancy in a given city was associated with the extent to which there was racial and ethnic neighborhood segregation. Essentially, you can think of it as sort of spatial clustering by race, ethnicity within a city. And the more segregation, residential segregation that was observed, the higher the life expectancy gap in that city. And I think it tells a powerful story. I think life expectancy speaks to all of us, and it tells really a powerful story that is illuminated and illustrated a little bit in the next slide. This is a map. This actually gives the example of New York City, and we take on the left you see the top 5 cities with the largest gaps in life expectancy as compared to the 5 cities with the smallest gaps in life expectancy. And so in Chicago, there's as much as a 30-year difference by census tract in life expectancy compared to at the other end of the spectrum in Fishers, Indiana, 2.4 years. Now you might say, well, Chicago's a much bigger city. You expect that to be more likely to have a larger gap in life expectancy, but that turns out not to really explain these differences in a full fashion, and segregation really jumps out as a key driver of this. And we think that that reflects chronic disinvestment in the core drivers of health, like housing, education, access to healthcare, safe water, and safe air, and points cities to actionable policy interventions that they could take to try to close those gaps. So that's an example of the kind of work that that we hope will be stimulated by the release of these new data, and in cities and neighborhoods adoption of or uptake of the dashboard in the year ahead. Next slide. So before we transition to our next speaker, really just any thoughts about these trends that you've just seen in terms of life expectancy and racial ethnic segregation, please share them with the group, and then we will have a chance to go through them and respond a little bit in the Q&A section. So if you have a moment, type in what might surprise you about these trends that we just discussed, and then we will collate those and circle back shortly. Great. All right. I think next slide. So it's a pleasure now to introduce my colleague, Shoshana Levine, who is Program Director for the City Health Dashboard here at NYU. Shoshana.
Thank you very much, Mark. So next slide. So I'm going to talk today a little bit about our site improvements. For those of you who have used the dashboard before, you'll get a sense for some of the differences. For those of you who are new users, things might not look that different than you expect, but we hope that you're excited about what you see. So the site improvements that we've really worked on in the past year are a few tweaks, improving navigation and user experience, really always trying to make the experience best for the users. We've added multi-year data for 29 of our 37 measures. We've built a new metric comparison map data visualizations, which I'll show you in just a few minutes, that we're really excited about. We've really worked on our take action section, pulling in resources to make that section of the site as actionable and practical as possible. We're also going to be launching a new API And we're working on new customized data services. So next slide, please. So now I'm actually going to do a demo of the site. So I'm going to show you the screen. That is not the homepage. This is the homepage that you will get to when you come to cityhealthdashboard.com. And just as a reminder, because we sometimes get this question, the site is free and open to the public. You just need an internet connection to have all of this data at your fingertips. And so again, I'm going to kind of move a little bit quickly through the site, really focusing on the new features. So I'm not going to get into every different thing that you can do on the site, but I'm happy to come back to it during the Q&A or answer any questions you might have about the site's functionality during that portion of the webinar later today. So you start with looking at the health in your city. So let's say we want to look at Buffalo, New York. So we just start typing that in there and we can click. And you'll see, if you're more familiar with the site right away, that our metric selector has really been streamlined so that you get a sense of what all of the measures that you can access are on first glance. So these are the measures that Mark pulled up earlier. And you can just get a sense for really the breadth of information on the site. But maybe you're not quite sure where you want to start today. So we also give you the chance to just get to an overview of all of the data for Buffalo, New York. And I'll just start there today. So now, if I scroll down the screen, I can see how Buffalo is doing on all of the different dashboard metrics. As I'm scrolling, perhaps something like children in poverty is of particular interest to me. So if I open that there, we can see some more information about the metric, a map for children in poverty, and if I want to explore that even more, I would click right here, and that would take us to a metric detail page. And so again, for those of you more familiar with this site, this has been streamlined a little bit to make it a little easier to use and see. We have some more information about the measure here, and then then we can scroll down and see the data for children in poverty in Buffalo, New York. And you can see here that 47.2% of Buffalo's children are living in poverty compared to an average of 22.6 across the dashboard's 500 cities. And we can also see a map down here that shows how those differences in neighborhoods play out across the city. So now if I click on maybe these census tracts, we can see that census tracts that are right next to each other can have really vastly different outcomes in terms of this measure. Something else that we've added to this site, sorry, we're having some, is that what if you're interested in previous year's data? So we've added for 29 of our measures, as I mentioned earlier, some multi-year data for these measures. So if I maybe want to look at 2013 data for children in poverty, we can see that actually overall for the city, the value doesn't change all that much. But if we go back, and sorry, I've uncentered our map, but if we go back to those census tracts that we were looking at earlier, we can see that there was really a vast difference between the values for these census tracts, and now they're actually much closer together in 2013. So we can actually see that in one census tract, there seems to be some improvement over time. So we're really excited about this feature and being able to explore these neighborhoods as well. So the demographic detail page gives some demographic detail about what's going on in these cities, and I'm not going to get too much into this right here, as this really hasn't changed between our initial launch and some of our new features, as well as our compare across cities. This is a really exciting feature where you can filter to find some peer comparisons but I'm not really going to go into that any further at the moment. And again, I'm more than happy to answer questions about that later. But what I'm really excited to show you is, and I'm going to pull back the 2017 data, is a new data visualization tool that we have on the site. So for example, if I'm interested in the relationship between childhood poverty and mental health issues within Buffalo neighborhoods, we have this new metric comparison map that can be used to understand geographic patterns found for these measures. You can see as I scroll down that neighborhoods that have higher rates of childhood poverty, which is indicated by those darker blue census tracts, also tend to have higher rates of frequent mental distress, and those are those darker red dots. Now, of course, this doesn't mean that one causes one another, and it's not, and that relationship isn't the case in every single neighborhood within Buffalo, but it can really give us an idea for how these issues may move together within neighborhoods across the city. In addition, in tracts where, for example, poverty is high, but mental distress is actually low, we can look to these examples of quote unquote positive deviance to try and get an idea of what's working to improve health outcomes in underserved neighborhoods. We're also really excited today to show you the Take Action, the new content on the Take Action page. Now, what I'm going to show you is on the Take Action page for Children in Poverty in Buffalo, but you can also access this information in the menu bar just right over here on that Take Action page as well. So if I click on Find Programs and Policies, this is, for those of you who have been on the site before, this is most similar to the content that we've been providing on this page. So you'll see, though, that we've added a number of new, really fantastic sources for actionable policies and programs that can be implemented in your community to address the issues that we have within the dashboard. And you can switch between metrics to find policies and programs on different topics as well. But we've also added these 4 buckets on the right, which we really think about as practical tools to help get this work done. So there are a number of resources for getting the right people to the table under Find Partners. We have strategies for communication, for advocacy, for stakeholder engagement, and other tools for action. We have a funding finder because we all need help funding our work in public health. And finally, we have resources to help evaluate the impact of the work you're doing, because we know that measuring impact is really a huge part of this work. So we're also really excited to be launching an API. That will be going live on June 12th. And so stay tuned and make sure you're subscribed to our email list or you follow us on social media to be one of the first to know when this new feature is available. And you can access that right here in the data access page, which you get to from the menu as well as at the bottom in the footer of the page. And you can access our data for download in CSV. And you can see here, once this goes live, this will be here on June 12th. And finally, we're putting together a suite of customized data services to really help meet the needs of users who want to explore their data in more depth. And Dr. Gravich touched on this earlier. And if you're interested, please reach out, and we'd be more than happy to explore a collaboration. So Michelle, if you want to take us back to the slides. And while she's doing that, again, if you have any questions about the dashboard, any of the features that I showed, or any kind of more general questions about the site, I'd be more than happy to answer them in the Q&A portion. And we had a question about, does launch an API mean you have developed an app? And I'll just clarify that API stands for
Application.
Programming interface. application programming interface, and is really just a way to access the data for download. We don't have an app, but you can, the site is mobile responsive, which means that it is actually really easy to use on your phone, just from your phone's browser. So next, these slides can just show you what I've already shown you. And next, one more. And so we're really interested to hear what new features are you most excited about using the dashboard? So you can answer via the poll, which will come up in just a second. And you can choose all three if you're most interested in all of them. But the metric comparison maps, our new Take Action Center, or being able to look at multiple years of data in the dashboard. We'll keep that open for just a few more seconds.
Great, I'm gonna go ahead and close the poll. I think people are starting to finish up their responses.
Great, so people are really excited about the metric comparison maps, which I will tell you we are too. We spent a lot of time thinking about the best way to display that data in a way that's comprehensible and accessible. So thank you very much for appreciating that. And we're also really excited to see that so many people are interested in using the Take Action Center and our multi-year data as well.
Many people voted twice. That's outstanding.
3 times, actually.
Even that.
Oh, great. So now that you know more, how will you use the dashboard in your work? So you can tell us that via the chat, and we'll compile those and pull some of that information for you as the webinar goes along. So keep typing, but we'll move to the next slide. And I'm really excited to introduce Becky Jo Glover from the city of Grand Rapids, Michigan, who has been a great partner through the development of the dashboard. She's been on our city advisory committee and continues to use the dashboard within Grand Rapids even today, and so we're excited to hear from her, to hear about her experiences in Grand Rapids.
Thanks, Shoshana. Appreciate that. Next slide, please. So at our city level here in Grand Rapids, like Shoshana told you, we've been with the City Health Dashboard since the beginning as an advisory board member. But what's really been great is that because in the last year, I'm just going to give you some highlights of what's been happening, because we have matured and grown and become a city where we're using this data, not only within the city, but within our partners. So just real quick before I get into Invest Health, the city has never had in our strategic plan, one of the priorities, health. And because of the work that we've been doing with City Health Dashboard, and we've actually added all of this data, all the data sets to our open data site, which we're really happy about, because we've got some of our Civic Lab, Code for America, using some of our data with some of the ACS data out there as well, and putting some dashboards together. But what's really come about is that for the first time ever, and it passed in April, we now have a strategic priority because of our work with City Health Dashboard that specifically calls out health in the city of Grand Rapids. Now, the reason why that's so special is because normally for us, the health in our city is at that Kent County level. And so all the health department and those type of things are mirrored around that. And of course, we work in partnership. But how exciting for us, because of our integration with this program and with this data, that we can have it on our open data site, but as well, part of our strategic plan adopted in April. But what I really want to talk to you today about is that we knew when we first started working with City Health Dashboard, because of where the health components lie within the city and within the county, we needed to go out and find partners. So it's a little bit different than someone that would have been working and has their own health department in their city. We went to our health department and we went to some nonprofits, one of them, Invest Health, and to start working with them and just introduce the dashboard. And what we've done because of that is we are now embedded with Invest Health as a partner in some of their new initiatives using the City Health dashboard. And they also, on their open data site, we've been able to give them this data as well and place it there as a partner. But what's more important is that for the first time ever, this dashboard information, the City Health dashboard, is being used in our health and all policies now in our strategic plan. And so as we move forward here in the city, as we start aggregating our data and we start reporting out on this strategic priority, we will be using, as part of our report out, the correlation between the City Health dashboard and the metrics, of course, that the departments are doing. This is huge for the city. This has all taken place in less than 1 year. And so it just shows you when you're able to continue to show people what's available out there, that we do not have the capacity to gather or to be part of, that we have this partner out of NYU that can give this to us and that we can download it. We're really excited about the API because right now we have it in CSV files on our open data site, which of course I'm in charge of, that's why it's there. And plus, making sure we've been very intentional about making sure our departments all know about this and are using it. Next slide, please. So, I saw a couple of questions in the chat, and I just want to talk about, the Kent County Health Department doesn't have the capacity or has an open data portal site. And we have to, of course, lie under the rules of HIPAA. But they had some information that they had scrubbed and cleaned up and met our governance standards, but they don't have any kind of tool or any open data portal. And we are working now with the health department to place all these on a separate portal, open data portal for the health department, along with the City Health dashboard and along with their data, because they want to start using this data in data-driven decisions as well as telling their story. Again, we don't fund the county, but we of course give them money out of our taxes and so forth. However, what a great partnership that a county and a city can work together to, because we have the capacity and have a site that has another sub-site, we're able to give them this information, but as well teach them and put that City Health dashboard alongside theirs and help them do some visualizations. And the tool we're using, of course, is Socrata for us here at the city. We are currently in a situation like most cities around the country that has a major lead issue. And we have a task force and we have some monies that finally, in a partnership, for many years it's been happening with the county. But because with some of the data that's been given to us by the City Health dashboard and other data that we've collected, we've been able to now put this task force in a higher level position. And through this budget that's coming out in July 1st, because again, City Health dashboard data that we had, putting it together, telling the story, we've been able to get more funds associated with cleaning up the lead paint in the homes around and working with the county around the city. Again, it just shows the partnership in where you can take the data to tell a more rich, robust story. And we're really excited about that because we are dedicated to trying to work and take care of this because we know how lead impacts our children. So the other thing I just want to say, you'll see some dashboards on there. We are now working with the City Health dashboard to be part of our equity story and to make the dashboard data that makes sense embedded into every single metric that the city will be reporting out in our strategic plan. And to me, this is the biggest win because as a city, it's very difficult many times for people to embrace, take on data that comes from other sources. But because of the intentional nature and how this team at NYU, led by Shoshana, has taken this data and been so deliberate and careful in vetting this data, that we feel so comfortable it's now become part of the story and the thread of who we are as a city in Grand Rapids and making sure that health for all policies are in place. We are just starting this journey. We have so much more to do, but I would say in the past year, it would have taken us 5 years to gather all this data that NYU has been able to give us. So we say great thank you to all the cities, and I hope that we can continue to lower that level of the threshold so we can get those 25,000 plus cities data, and we understand there's less there. But we all need to work together, and we're just really excited about what we've done here in the city of Grand Rapids and to show that it's possible when you're working with other data sets. So thank you, NYU. Thank you, Dr. Levine. Thank you, everyone from NYU that's made the City Health dashboard a working product for us to use as part of our organization.
Thank you, Joe. Thank you so much. What an extremely cogent and powerful overview and use case from Grand Rapids. Really just exceptionally illuminating. So, and hopefully useful to our many users on the audience. How can we help engage your city's partners to use the dashboard more? It's really a question for everyone on. Webinars, expert technical assistant, blogs, city spotlight, social media, let us know. Take a moment, please, and answer this poll.
Great, we'll leave that open for just another couple seconds.
Tremendous.
Great, we're going to go ahead and close this poll.
More of the, so it sounds like the webinar is a valuable channel, and certainly expert TA stands out, but really all of the above. I think it sends a message to us to keep a lot of irons in the various fires, and to be reaching people through multiple avenues, which is very helpful and reinforcing. Thank you. Next slide. So this is the time now that we have for Q&A with all of you. I think we're turning it over to our colleagues, Alicia and Michelle, to coordinate this section.
Hi, great. Yes, thank you. We've received a lot of great questions, so we're going to try and get through as many of them as possible. So the first question here talks about if there's any, as a new user, as we saw earlier, that we have a lot of new folks to the dashboard. Are there any areas of the website for best practices for people who are using data and developing successful programs that folks can refer to on the dashboard website?
So we have a couple of different places where you could find information like that. On our new Take Action section, we've added some resources for using data to make change. Specifically, we also have, we've written a number of blogs, and we're continuing to do so, helping people use the data that we're presenting on the dashboard, getting into different metrics that are maybe a little bit stickier, harder to understand, as well as we've explored the difference between city and county data and why we think this is so important. And then in terms of best practices for kind of making change, that's really what the Take Action section is all about. And we really hope, first, that you'll find something there that's useful to you. We've tried to pull out some of what we think are some really great resources from the people who are deep in this work and doing this work. And also, if there's something missing, or if you have a great policy or program in your community, we'd love to highlight that as well, and you can send that over to us.
Great, thank you. We have a few questions here asking about if the dashboard will be able to collect data for cities that have a smaller than 60,000 population. Are there any plans for that, City Health Dashboard team?
Yes, we are. There's two stages. So the short answer is this is very much on our to-do list in the near term. I've seen some people ask, well, how did you come up with a cut point of 66,000 anyway? And the answer is that we built the dashboard initially for the largest 500 cities in the U.S. And that was, we picked 500 in part because the CDC had just done a number of analyses for the largest 500 cities in the U.S. and we collaborated with them in using some of their data. So that's why we came up with 500. If you take the biggest city in the U.S. and you go down to number 500, its population is 66,000. So that's how we came up with the 66,000 number. It turns out that as you get below 66,000 or 50,000, some of the data get a little bit thinner. So our two-part approach is to first explore, and we're doing some pilot work with some cities that are smaller than 66,000 to see, well, if we, for our 37 measures, which of them are we actually in a statistically stable and reliable fashion able to calculate for smaller cities. And once we know that, we will know how we can scale it. Can we scale it to all cities that are 50,000? Can we scale it to for half of the measures for those? We don't know yet, and we're doing that work now. So stay tuned, but it's very much on our near-term agenda.
Great, thank you. Next question for Becky Jo. Can you talk a little bit more or provide a few tips on how cities who are trying to talk to their partners that perhaps are not in traditional public health agencies to try to build greater collaboration to kind of push the envelope a bit on addressing health equity issues and other types of public health issues? Do you have any tips for cities who are trying to build those relationships?
Sure. So I've got actually one really big one. You know, you said the traditional ones. What I did when we first started, my team, and I can't say my team and I, we went out and we started attending meetings that traditionally we would never, I mean, I'm in customer service and now innovation, but that we would never have attended. And as they started seeing us in the audience and we would be asking questions. Now that takes a little bit of time, but again, we also used introductions from the mayor level and our elected official level to introduce us to some of the people because, you know, people are skeptical regardless, and people's time is so valuable that they don't have the time to do it. So we felt going the opposite way of being in some of their meetings when they had open meetings and then introducing ourselves and continue to be there at the table. Because I just told you about one organization we're working with. We're working with 5 or 6 because we've gone to their meetings and now all of a sudden they want us to be part of it. We're on, we just put a grant in with an organization called Link Up here, who wants to use the City Health Dashboard. We're the representative of it, and the data, because we have it on our open data portal. But I have to tell you, it's a very difficult thing, especially to make time on people's schedule. Everybody on this call is so busy in our lives, and we all know how important this information that is in this dashboard is for us. And so we almost have to be even more, you can't see me behind this phone, and you might say, oh my gosh, she's so like way out there. Well, I'm very calm today. And so you almost have to take it upon yourself to be where they're at. It can't be emails. It can't be calling. It literally has to be in their space. And that's what we have found. And then, of course, all of these organizations are all connected. So once you get connected with 3 or 4 of them, they start introducing to you all of them. So that's how we started our movement and our organizational partnerships.
Great. Thanks, Becky.
Sure.
Couple questions about some of the customization and new services. And this is probably a 2-part question. How can users access technical assistance and or capacity building support to tell their stories? And then a related question is, can you talk a little bit more about the customization of data and how the dashboard could help cities with that? Is that a service that will be coming?
Yeah, that's a great question. So if you're interested in either learning more or partnering with us or getting some technical assistance, you can just reach out to us by email. Our email is info@cityhealthdashboard.com. And I think that Michelle put it in the chat earlier as well. We don't quite have a formal process for this yet, but it's something that we're working furiously on putting together. And so most of what we're doing right now has been just individuals or cities or groups reaching out to us in that way. So that's probably the best way to reach us. About customized data and services on the site, this is something that we're really interested in doing and testing out with cities that are looking to dig deeper into particular measures. So whether it's you have a great data set within your city that you don't really know how to visualize, or you don't have you want to share it with others in your city and you don't really have a place for it, or you're interested in some more measures from American Community Survey or other data sets that are already on our site. We're interested in potentially pulling over those data for you onto the site, as well as thinking about, as Mark mentioned earlier, are you interested in viewing your city as a congressional district, or in terms of congressional districts or school districts, or in another way that's more meaningful to the work that you're doing within your community? So those are just a few of the ideas that we've had, but since you're out there doing the work, I'm sure that, I hope that something here kind of sparked some interest or an idea that you've had, and we're really excited to kind of start these conversations and move them forward.
Shoshana, may I add something to that?
Yeah.
I encourage everybody on this webinar, what this started out as, the City Health Dashboard, and what it is today is an incredible growth in the accessibility and what they're able to offer. And it came from many of you on these type of calls telling them what you wanted. And I'm sorry, Shoshana, but I'm going to say it. There's been very few things that they've not been able to accomplish. Her team is one of the most incredible teams I've ever seen. And so I really encourage you, like Shoshana just told you, to just reach out and just ask those questions of kind of the things you're looking for. They're very agile and they're a very nimble team, and it's been a pleasure. I mean, there were some things today I saw that we had asked for just a couple of months ago, and how exciting it is to see them. So I really encourage you to use that process that Shoshana just talked about.
Great, thanks. Thanks, Becky. We just have a couple, time for one more or two more questions. There was a lot of surprise and a lot of questions about the new trends that you mentioned about segregation and life expectancy. Can you talk a little bit about when the data was the data disaggregated by race and ethnicity in each city? Did you see the same effects of city segregation on health? For example, did you control race and ethnicity in the model? And then also, can you talk a little bit about, were you surprised, people were surprised that this one person in particular was surprised that the lowest life expectancy gaps were more in Midwestern areas where populations are less diverse in general, and how is that accounted for in the segregation metrics? So perhaps just talking through a little bit more about some of the segregation and how you analyzed that data.
Sure. So I think the first point to make there is really that is a kind of, I'm looking for the right word, philosophical one. What we try to do with the dashboard in general is to highlight and make available really good data so that cities and communities, in a way that draws attention to issues, but that really allows cities and communities to dig deeper and engage themselves in, because it's really cities and communities that understand themselves at a deep level the best. So when we look at this data with, so we have not, to answer the question directly, sort of factored in differences in local racial and ethnic makeup of each city to in looking at the gap in life expectancy analysis that we presented there. That is work that can be done. We have not taken that additional step at this point. The concentration, what looked to be some Midwestern cities, I think you said, with lower life expectancy gaps, were they more racially or less racially and ethnically diverse? Yes, or segregated really. Yes, they were less segregated, but that can reflect more homogeneity, and we have not parsed all of those angles in this analysis. So your questions are spot on, and we would just encourage you, and we too will be doing some more exploration of that.
Great, thanks. And time for one last quick question. How often will the data be updated?
The data that's a great question. The data are updated as often as the underlying data sets are refreshed. So for example, if we have data on a certain measure that we draw it from a national data set, that national data set might be refreshed every March. So we then commit to refreshing the data on the dashboard following that national refresh. And I'll say we launched a year ago, and actually 80% of our measures have been updated and refreshed since just in the last year alone. So we really are looking for this not to be a stagnant site, but really as up to date and timely as the core data sets that power it are themselves.
Wonderful. Well, that's all the time that we have for today, but we encourage everyone, here is some more information on how to reach out to the dashboard if you have additional questions and want to learn more about the dashboard. We ask you to use this information here.
And I've had a few questions about when the recording and the slides will be shared. We'll be following up via email within the week to share the recording and the slides that were presented today. Thank you, everyone.
Thank you very much, everyone. See you on the dashboard.